For the women then who have been victimized and have survived these incidences, where can they get support or help at this point, given that there's all of these barriers?
I mean, definitely with Rape Crisis, we have counselling services in 3 different areas in Cape Town, so Khayelitsha, Observatory and Athlone. So you can come for counselling anytime. You can make a phone call as well. We have crisis lines are 24 hours and we can give you those numbers. But there are other services if you can't access our services as well. There's obviously, I think, crisis centres in different communities, but generally when a survivor does initially go, she'll go to a hospital, which is a forensic facility. They will do all of the processes there, and then from there they get referred to a service in their community.
I think it's really important to say also, though, that despite the systematic problems that we highlight, especially what I was talking about earlier, I mean, I think there are very committed people throughout the criminal justice system, in the healthcare system.
No, definitely.
And that you can get excellent quality care at Tutuzelas, for example, through Rape Crisis Counselling Service and a number of partner organizations.
And also, if you go onto our website, which is Rape Crisis, www.rapecrisis.org.za, you'll find there's a link there and under the different tabs around how to support a survivor. We also have, and it gives you the entire process, where she needs to go, what he or she needs to do. And then also there's a virtual tour that's on the site that talks to exactly the process. So you have from step 1, going to the police station, what she needs to expect. We have interviews with police officers, we have interviews with prosecutors, with counsellors, so it gives you the entire process from the minute she wants to report until when she comes for counselling.
And I think an empowered survivor is one of the most powerful things. So when a survivor knows and understands what to expect and knows what questions to ask, where she should be going if that doesn't happen, to say, you know, can you give me a referral to, I need to get post-exposure prophylaxis, for example. We know that it's critical for a rape survivor to receive post-exposure prophylaxis within 72 hours, but the sooner after the incident, the better. So whether she knows whether she wants to report that incident or not, she doesn't need to report to the police to receive post-exposure prophylaxis from a healthcare facility. That's one of the most critical things that you can do within as soon after, but within 72 hours. The medication no longer works after 72 hours. So that's point number 1. Number 2, have a medical legal examination so that evidence, if it is there, is kept. You don't need to lay a charge to have a medical legal examination. You can decide at a later stage, but if you decide at a later stage that you do want to continue with a case and that exam hasn't been done at the first instance, it becomes much more difficult to have a successful conviction.
Because the crime has been committed on the survivor's body, all the evidence is right there. So what Kyle is referring to in terms of that evidence doesn't live for very long. It's within 72 hours. So you've got to do all the swabs, you've got to do all the forensic medical examinations, all of those things. If you're going to go, 72 hours is basically almost 3 days. So if you're going to go, or 3 days, you're going to go beyond that. You can't think of somebody not washing for 3 days. So you've got to get it done as soon as possible, because the minute you start washing or going to bathroom, all of that evidence is lost as you're moving along. So trying to get the survivor to a point of, even if she doesn't want to, like Alice says, lay the charge now, she might want to lay it later on, but the evidence is there to be collected and has been collected, as well as getting the medication for PEP.